Many of us with curly or highly textured hair look for ways to protect our ends from breakage that can happen from overstyling. But it's really important to know that not all protective styles are always protective for our hair and scalp. We consider protective styles like braids or twists with added hair, hair weaves, crocheted styles. Sometimes those styles put too much tension on our hair and on our hair follicles. And this can lead to a condition called traction alopecia, which in the short term is reversible, but in the long term can become irreversible. So it's really important that we do things like rotate our hairstyles so that there's not constant traction on the scalp. Find braiders who don't braid too tight. If you need acetaminophen, your braids are probably too tight.
You can use what we consider low manipulation styles, things that don't put a lot of tension on the scalp or the hair follicles. Your style should not be painful, it should not feel tight, and you should not feel any stress on your head or the rest of your hair. It's important to make sure that if you're experiencing any symptoms from any style, that you have it removed. It's also important to know that if you're doing a protective style that is going to be in your hair for multiple weeks at a time, that you still regularly cleanse your scalp so that it can remain clean and healthy, as well as conditioning your hair and keeping it moisturized. Straightening your hair can be a safe option, especially if you're using a heat protectant to prevent some of the damaging effects to the hair. I would also recommend that you not straighten every day to help avoid cumulative damage to the hair. The most important thing to note about keeping your hair healthy is keeping your hair cleansed. It's important to regularly wash your hair to make sure that you remove dirt, debris, and any buildup, and also ensure that you have a healthy scalp to ensure that you have healthy hair.
It's important that you pay attention to any underlying scalp problems. Sometimes we use protective styles because we're trying to conceal underlying hair loss. And it's really important to know that sometimes those protective styles can make the underlying hair loss worse. So if you were experiencing hair loss or other scalp problems like persistent irritation, itching, burning, or tenderheadedness, or excessive flaking, it's important that you go see a board-certified dermatologist who is accustomed to treating people with skin of color and highly textured hair. You can find such a board-certified dermatologist on the Skin of Color Society website using our Find a Doctor tool.